It's your boy, Chris, the Hickory Algorithm. Today on our video pod, we have Jeff Smith from Biokinetics Rehab. He's been gracious enough to let us set up in his shop. Jeff, thank you very much,
Oh, you're
man.
welcome. Glad
It's
to have you
awesome.
here, Chris. Thank you.
So let's just jump right into it, man. What sets you apart from other physical therapists in the area?
Well, I think the thing that sets me apart the most is coming in with experience. I have been doing this for over 35 years. My certification is in orthopedics, even though I have worked in a variety of settings with people with neurological issues, balance issues, deconditioning, things like that. I've worked primarily with athletes. And I try to, get those weekend warriors that just really want to come back and try to get to a higher level. They want to go out and play with their kids without having to have pain or worry about what they're going to do the next day after doing this. We really focus here on one-on-one care. It's 60-minute durations. You're going to have the same therapist each time. I don't like it when people are saying, yeah, I went to whoever happened to be free. They were able to get me on a schedule, and then they're spending time trying to figure out who I am or what they did before. So sessions should be moving forward, and the focus I really try to get the emphasis on, I guess, would be what are the goals that are really important to the patient. I have people that come in and they were told, well, we're discharged because I'm functional now. I can do things, but I'm not where I want to be.
Right.
And so our focus here is let's get you back to what you want. I really want to focus on what's important to the patient.
Well, with that being said, man, that's you hit it right out of the park with that. But what do you wish people understood more about physical therapy?
I think the biggest thing, we're seeing educated consumers now. People get online. They understand things more. They're taking a stance where they're more of an advocate for themselves. So what I wish people would understand too is that you've got the right to go where you want to go. You do not have to have a physician referral to come and see me. If you say, I want to go and have somebody look at my neck or my back or my knee, or to look at my technique with something of how I'm moving, how I'm lifting, how I'm sleeping, whatever, I can take a look at that and give some advice. So I really encourage people to come in before you start having problems. Don't wait until you're injured. Don't wait until you've had surgery or an injection or I'm on medication. Come and see me and see if are there things that we can do to try to figure out why you're having this problem instead of just taking a pill to treat the symptoms.
Right.
So I really encourage people to kind of use me as that resource. I don't mind if you don't come here for therapy. If you have a question, call me. That's why I'm here. I like to help you. I don't mind where you go. I just want to get you better. And I tell people too that let's let's look at the big picture of what you are trying to attain overall. We can treat symptoms and we do want to get people feeling better, but I want to find out why are you having the issues you're having? Let's move towards that direction. And I'd encourage people to come in and do an annual wellness check. You go and see your physician each year. You see your dentist twice a year. Come and see your physical therapist. Let's look at your balance. Let's look at your mobility, your flexibility, and try to determine what can we do to make it more productive during your day so that you don't have issues popping up and then needing somebody to do more care.
Yeah. The big question that I have is, do you take insurance?
We are out of network, meaning that, yes, we don't take the insurance like you would traditionally in network where you come, present your card, and here's your copay. With us, you pay for it up front. You're going to get an invoice. All the coding is the same. All the documentation is the same. You submit that to your insurance carrier. They're going to reimburse the patient directly. We have it right on the super bill. We are not a provider of that. They will pay directly to it. If somebody makes a mistake, we're going to correct that.
Right.
But that way they can choose where they go. And the reason we choose to be out of network is that we don't want to have the constraints that insurance puts upon. If somebody's being told, you have to go here and you can only be seen this much, and again, they're not where they want to be, that's not helping them.
Right.
You're paying a lot of money for something. You want to get the best care. So, you're going to be here for a longer duration of care and you're going to be one-on-one and we're going to focus on what you need. But during that time, you're going to see, I don't need to go for therapy as much. And I got further along because of it.
Right.
So it's not to discredit. We've got incredible therapy here in Hickory, but our outcomes here are just outstanding.
Yep.
And again, I've been doing it long enough to understand. It's not that I'm a great therapist and I'm better than somebody. It's that I know what's worked and what hasn't over the years. And I really focus on let's get down to what's the reason you're here.
Man, I think what you said just knocks it out of the park. We're a lot of physical therapies. I had a torn meniscus in my knee at work, and man, the physical therapist made the difference for me.
Good.
And I had those things, where I I went to different physical therapists, because I was in the system, and I showed up at 10 a.m. every Tuesday, and I got
Yes.
somebody different.
Hmm.
But it wasn't until I had a good physical therapist who took the time and who wanted to know and wanted me to never come there again
Yes.
that really opened my eyes to what good care should be like. Because if you're trying to make the person better and get them out and get them back to go play with their kids and go do those things, that's what you're there for.
Absolutely.
Not to keep showing up at 10 o'clock every Tuesday and just, be just punching a card, it feels like,
Your best clinicians are going to give that same response. Our goal is not to have you dependent upon us.
Right.
It doesn't mean that there's a time that, if you could do it all yourself, you would. And we have people that will consult Dr. Google and try to figure out what to do.
Google's good, dude.
And that's wonderful, but that's really not giving you what you need. And
Yeah.
if it was as easy as opening a book and following a recipe, everybody would be doing it. We don't
Right.
need to have specialists and things. But the goal is really, again, to identify what is it you need. There are times that we need to do symptom management. There's times that somebody might need adjustment. They might need hands-on massage work, and all that's great. And there's nothing wrong, but we don't want somebody dependent upon that to get
Right.
them better. So it shouldn't be, I have to go every Tuesday, like you said. It's that our goal is, I want to get you to a point where you understand what's going on and how you need to do it. I see somebody for an hour or two a week. The other 166 hours are up to
Right.
them. So you can't just say, here, I'm here, fix me. It's, I'm going to lead you down the path. I'm going to give you a lot of education. I spend a lot of time really trying to educate the consumer as to, this is what's going on with you. This is the anatomy. Not that you have to understand it all, but I just want you to get, this is why this is giving you issues.
Right.
If you understand it, you're going to have more compliance. And if you have compliance, I don't need to see you over and over for the same issue.
Right.
It's, let's teach you what you need to do, and then come to me when something else is presenting, or if you have something just kind of needs like a little touch up, then let's figure out what changed. And then we make those modifications for you.
So how long have you been in physical therapy?
I started in 1989.
My kids call that the 1900s,
Yes,
by the
exactly.
way.
Yes. Last century.
Yeah,
Yes,
they
it's
said that. That's
awful.
the 1900s.
Yeah, so it's been 35 years. I started working with Division I athletes. I was at University of Toledo, and then I was down in Florida. I was there for about a year working pro sports with Minnesota Twins. I was also covering the high schools in the area.
Yeah.
I thought I was going to go into orthopedic surgery. That
Really?
was my direction initially. And one of the orthopedic surgeons said, I don't see you doing that. That just is not what you want. Like, I don't know what I want. But sports medicine wasn't really a term that was out there yet.
Right.
Nobody really knew what that was. And he says, I want you to go up to see a friend of mine in Atlanta and stay with him for a little bit. And I stayed for a week with this wonderful physician, Fred Allman.
How old? That was that 89?
Yes, I was 23 at the time, 24. And yeah, I think that's about right. And and Dr. Allman brought me in. He's an orthopedic surgeon for the Falcons, Hawks, and the Braves. He's on the 13th floor in Midtown Atlanta, beautiful suite,
Living the
surgery
dream.
center inside. It was just the dream. And I thought, this is what I want, and followed around for the day. And I thought, this is miserable because it's a minute here, a minute there. His assistants are doing everything. You didn't have physician assistants and nurse practitioners doing as much then. That wasn't really a thing,
Right.
but he had his people helping him, but he was just kind of popping in and out like the mechanic. And I thought, okay, I get it, but yeah, that's not really what I want. We walk down the hall, and I look through these glass walls, and I see people doing physical therapy, and I didn't know what that was. To me, in my town, growing up in Ohio, physical therapy was, the two guys in the hospital that taught you how to walk with crutches
Yes,
after you broke
that's
your
exactly.
leg.
Yep.
Or somebody had a stroke, let's show you how to get out
Yep.
of bed. And I'm watching these guys, and I'm like, this is fun, and this is high energy. And what are they? Those are PTs. And what are they doing? Sports medicine. Brand new to me, and I fell in love with it.
Dude,
So I worked on my master's at Georgia State in biomechanics until I got into North Georgia College for my master's in physical therapy.
And when did you get your master's? When was that
96,
day?
I was when I
96.
graduated. And then I went back for my doctorate. I have a post-professional doctorate. I went back in 2004, and that was 7 years of training and dissertation and that. So
Dude, congratulations,
Thank you.
man. That's awesome, dude.
it was the best thing I've ever done.
Yeah.
I wanted to pick the toughest program out there, and I went to University of Maryland. And there's a strong emphasis on biomechanics, which is what I really enjoy looking at. Again, I like the physiology aspect, the applied anatomy. And I'm not a physics student, but I love being able to put that into play.
Yeah.
And it made sense to me. And that was the program that was really probably best directed for me.
Yeah, man. And even just looking around when we were setting up in here, man, I mean, everything has a purpose. It has a thing that you specifically want it for. and it's just impressive, man. The more
Thank you.
we look around to stuff, and you even have a is that a cold tank back
Yes, I
there?
have two cold plunge tubs. So yeah, cold plunge is just a wonderful modality, just to try to help decrease inflammation, increase metabolism, just try to reset the parasympathetic system. So we have two nervous systems, basically. When you
Okay.
talk the autonomic nervous system, you've got the sympathetic and the parasympathetic responses within that. Sympathetic is like your fight or flight. You know, you get startled and you get the adrenaline rush, and am I going to fight or am I going to run type of thing. Well, a lot of people, especially nowadays, you know, we're running on that system a lot more than we should. There's a lot of anxiety, a lot of stress is going on, and you need to learn how to shut that off. That's the parasympathetic response that's trying to come in. We're trying to calm things back down so we're not always in a kind of a heightened state, an anxious state. And I see so many people coming in because we're at computers, we're hunched forward, our shoulders are up to our ears. You need to learn to relax. And it's not just relax, deep breathe. Yes, those are great strategies. Doing a cold plunge is another way to kind of get in there and get that mind control of, I've got to focus on trying to breathe in this 52-degree tank and settle everything down. And it might be 3 minutes, 4 minutes. It feels like an hour.
Yeah.
But when you get done, you feel so energized because it's like, I've gotten control of this. I mean, I thought I needed to jump out of this in the first 10 seconds, but I was able to control myself to sit in here and get my breathing under my control again.
You know, my buddy, big personal trainer up in Philadelphia, and he keeps telling me, he's like, dude, you got to do the cold plunge.
It's wonderful.
You got to. And I was like, man, and what I do is I get up when my kids leave the house, I go to the gym. And like when they leave for school, I go to the gym, and I'll be there for good. And I'm basically, all I'm doing is running and riding a bike in half-hour increments. But he was like, dude, you got to try. He's like, it will help you in ways that, because I'm like, how long do you sit in it for? Like, how long?
Just a couple minutes. You know, really, you're talking maybe 3 minutes, 4 minutes.
Is that all it is?
It is, yes. Now, I have people that will get up to 6 or 7 minutes, you know, and you don't really need to go too much more. I wouldn't let anybody go more than 10, but I haven't had anybody go more than 10. I have some MMA fighters in town that might get to 7 minutes, you know, and it's brutal. When you're shivering, you need to be out of there. And I've had people that have tried elsewhere to go longer, and it's, you know, and I had somebody this year, just a month ago, that came in, neck was so locked up because he was sitting in this cold tub for 10 minutes because he was told this is what you're supposed to do.
Talking about. He's
just locking up, and his neck was just in spasm. And he's like, what did I do? And I said, you were too cold. And he said, I was shivering for 40 minutes after. So that's called hypothermia. You know, that's dangerous. You know, no, you don't do that. But he didn't know. And, you know, he said, well, I listened to Joe Rogan, and he says it should be 37 degrees and suck it up and get in there. It's like, no, that's not the science. Right. It's okay if that's what somebody wants, but that's not the science. And everything I do is very scientifically based. You know, you're going to have a reason why we do things. And I appreciate the compliment on the facility. It was, again, I've done this long enough to know what is good equipment and what's not, what's a fad and what isn't. Let's come up with the things that really are going to make a difference. So I had the luxury of being able to come in and have this empty shell of a place and figure out, what do I want to put in it? And after years of thinking about things, it wasn't always my dream to have my own place, but you always think about, what would I do differently?
Yes.
So I was just blessed to be able to come in here and do that. But it's just really coming down to, let's put, you know, there's a rationale, a reason behind everything that we do here. Everything's very intentional. So I appreciate the comment of how the layout is. I'm proud of it.
Yeah, you should be, man. It's nice. Man, my fingers are cold. Just like talking about it.
Yes.
Dude. I was in there recording that, and I was like, now you're talking about it. I'm like, man, my fingers are cold. So when would you recommend somebody to take a cold plunge? Would you say like after a workout, or when would be the best? Somebody, this is just me personally, because I don't know. But when would you recommend me? After the gym, after you do those things?
I would do it after your workout typically, because you know, now you can go about things two ways. And the way the recovery room is set up is we have the cold plunge tubs, we have infrared sauna, and we have Normatec compression sleeves. So somebody comes in, they say, I want to use this room. It's 45 minutes, it's yours. It's not going to be everybody else walking in and now you're in there with somebody you don't know or something. It's your room. Now, people can come. I have 2 tubs because a lot of times people want to come with a friend or a loved one or something, and they don't want to go through this torture alone. And they're like, I've never done this. Come with me. Come with me. So we have 2 tubs. So I tell people, come in, try it out. It's free the first time. But I would recommend, if you're going to come in and if you've got a workout going, do your workout and then come on over. We have showers here. Okay. I have shampoo and soap in there and everything. So you can get all cleaned up, go do this, get cleaned up again, and go back to work if you wanted to. I have some people that come in later in the day and they say, I've done everything else. I want to come here and do that. I said, then at that point, you might want to do the sauna after and kind of relax a little bit. The cold plunge is going to wake you up. It's invigorating. You get in that sauna, now you're relaxed. And they'll say, man, I go home and I'm out. But if I come in here at noon and do it, I need to finish with the cold plunge because otherwise I'm sleepy the rest of the day. So it depends on what you're trying to accomplish. You can come anytime, but it's hard to do that and then feel like working out. Even though you've got the energy, it's like, I don't want to go and throw some weight around or get on a bike or anything. It's
your body's like, dude,
I've got a different stimulus going on and I don't feel like doing that now.
So if I rented that room for the 45 minutes, what would you recommend someone like me? Would you just say, Chris, go in there for the sauna for, however many minutes? Again, I've never even been in the sauna.
I would tell you, especially the first time, like I say, it's free. Come try it all. Do all of it. I would say get in that tub for a couple minutes and see what you can do. It might be 2-3 minutes. Who cares? Nobody cares. You do what you can do. Get in it and just try to get control of your breathing. Get out, dry off, get in that sauna, warm back up, get in the chair that we have and put on those compression sleeves and feel that. It can be on the legs, it can be on the hips, it can be on the arms.
Is that what was on the
hanging on the wall?
Yeah, that's what those were. Okay.
So, and it's just amazing. It's like getting a massage in a sense, not as good, but it's a very nice massage. But it's working itself up to the heart, trying to push out that swelling that you create. Wow. So I usually say, kind of try all of it. Yeah. I have some of my athletes that come and say, I just want to get on that compression. I had a hard leg workout. I just want to do that. And I said, well, that's okay. But maybe put your legs in the water for a little bit first and then do that. And even better. So there's a lot of ways to deliver cold. I think this is the most effective. When I was researching which way to go, I thought immersion is the best way. It's got, again, the best science. I want to get that depth of penetration in the least amount of time. It's safe. You're going to get in there and you'll know right away. It's like, I can see where this is going to help me. It makes a tremendous difference. But I would tell you, try all three out. Yeah. It's great.
Why would someone want it colder? Is it just more fight or flight? Is it just more releasing?
Is it in that stage where it's more is better? We want things right away. Right. So, hey, if 2 aspirin get me better in half an hour, I will take 4 and get better in 15 minutes. It doesn't work that way. Right. Yeah. So, sometimes people think colder is better, but you got to look at the science behind things. There's always a rationale and there's a point. And it's like, if the research is saying this is what you need to do and where they've gotten the best results, then do that. Right. So to tweak it and say, you know what, hey, 54, 52 was great. Okay, I'll go to 48. That'll be better. We don't know that. It hasn't been shown to me. So why do what hasn't been shown? Right. Focus on what works.
Yeah, it's just wild that you see 37 degrees, or some guy that's been working out. And I'm not disregarding him at all because he knows a heck of a lot more than I do. But when you hear something like 37 degrees in the cold, I'm like, what are we trying to accomplish here?
Yes. Well, and there's also bragging rights.
It's bro. I always say bro. Yes. Yeah.
So it's, kind of the guys that want to throw 300 pound on a bench. It's like, is anybody going to wear a shirt that says you did it? Nobody cares. Right. So do things the right way. But a lot of times it is that, to be able to say, yes, I got down to this temperature. But again, it depends on why you're doing it. If you're doing this because you are looking for the health benefits out of it, the physiological change, then do what's been shown to be most effective.
Yeah. And then would you recommend something like my oldest son is 16 and he's been working out with me. I mean, he's bigger than I am. He's the biggest kid in the house, 6'1", like just jacked. He's a freshman in high school. But he's been working out with me when he's not in school. Would that be okay for someone at his age?
Yes, it is.
Is it?
Yes.
Okay.
Yeah, I don't like to go much younger than 16.
Okay.
Some people, you can get down to 14, but it's kind of pushing it there.
Yeah.
It
makes you uneasy.
As comfortable.
Yeah.
Yes, I'd rather, 16 with a parent type of thing.
Yeah, that's what I would, yeah.
So, yes, he can definitely do it. And, now again, there are people that say, I'm going to kind of condition myself for this. I'll do cold showers and cold baths at home. And that's still very effective.
Yes.
Anything under body temperature, it's going to be beneficial.
Yeah.
But if you really want to get the effect, that's it. And it would be good for him. And it's fun. So it's something I would tell you, come over together and try it sometime. I have one set at 60 just because sometimes 52 is intimidating. Yeah. So one person gets in one, the other. I can easily turn those temperatures anywhere I want. And it will go down to 37. I just don't bring it down to 37. But you'll see, even 60 is miserable, but the people that are used to doing 52 and they get in 60 and say, okay, it's cold, but I could see the difference. But either way, it's cold.
Yeah. Jake, you're doing it at the same temperature that I do it, bud. Like that's happening. Yes. Don't think I know he
just
said.
Let me know and I'll get that ready for him.
It's like, dude, yeah. But yeah, he would love to do that, man. That's awesome. And another thing, man, we were talking earlier about youth sports, and I'm such a huge fan of youth sports,
Yes.
man. And one of the big things when I coached middle school football, it was like pulling teeth, getting those kids to do even like high knees and stretching and those
Oh,
kind of
yes.
things. Because it's just like, Coach Chris, like we don't need to, and it's like you're sixth and seventh grade, you're probably you're like Gumby compared to someone like me, you know what
Absolutely.
I mean? But they don't want to hear Coach Chris say, "Hey, we got to do our stretches."
Yes.
So I'm gonna let Coach Jeff tell them why they have to do their
Oh, I had the
stretches.
same thing. I was blessed to coach girls basketball. We had girls at fifth grade all the way up through high school, and it was, working travel ball and working in the middle school and high school with some wonderful athletes.
Yeah.
And I would get the same thing. It's like, and you're right. At that age, they're like, I don't need to stretch. I don't have issues. Yes, I need to stretch for an hour before I can think of running up and down the court with you. Otherwise, I'm not getting out of bed tomorrow.
Yeah, dude.
But yes, it's injury prevention. And
Yeah.
there's a lot of static out there of stretching. It's not good for you, type of a thing. Well, there's static and there's dynamic stretching. Static stretching is where we're holding it. Dynamic is where we're moving back and forth. Michael Phelps at the Olympics, swinging his arms,
Yes.
is dynamic stretching. What people don't realize is he's doing that because he's getting ready to jump out of the blocks and go full speed. You didn't see him an hour ago. He was in the warm-up pool doing some laps. He's doing static stretching. He's got percussion massagers on. They're doing scraping and cupping on him. He's doing all kinds of things to warm up and be ready. Then he puts on his heavy parka,
Right.
walks over, gets on the blocks, and everybody sees him swing his arms and say, that's the only way to stretch. Like,
Right.
You didn't see everything else. You need to get those muscles loosened up. You want to try to have good mobility throughout all the joints. Everybody has limitations on things. I have gymnasts that, I can put my hands on the floor, yes, and they've got some of the worst hamstrings in the world because it's all low back mobility. And like, you need to stretch your hamstrings. Nowadays, everybody's sitting. I see tight chest, shoulders. I see tightness within the hamstrings and hip flexors because we're in a flexed position so much. We need to get that out. And kids, especially now, they're in classrooms all day long, or the ones that are homeschooled or they're virtual learning,
Right.
They're sitting in terrible postures in bed, watching their class online all day long. We need to try to get that mobility normalized.
Yeah, I think it was. I went to one of you were coming around town here in Hickory, doing. I think you were doing like almost like a pop up with a financial advisor.
Yes.
I remember I went, and you talked about TechNeck.
Yes.
Yeah,
That's
you went
correct.
and you talked about TechNeck,
Mm.
and I remember you saying it, and I remember the whole room like sort of like substitute teacher, like what is
Yes.
he talking about? But when you handed that out and you started talking, you started saying we sit and we, you don't know you're doing it because you're doing it so often. And I remember going home and talking to my wife and saying, there's a guy there I never met before, and and I'm saying, and he was talking about TechNeck, and like she sort of looked at me like, what are you talking about? But then I started explaining what you were saying, and she was like, he's not like making, like he knows what he's talking about.
Yeah.
You know what I mean? It's like, but you don't think of things like that because we just do it every day,
Yes.
over and over and over again. And then all of a sudden someone's just like, my neck hurts a little
Exactly.
bit.
And that's what I see quite a bit here. Is people come in and like, I don't really know what I did. I just had somebody today, a friend that came and he says, my neck, is just jacked up. I don't know what I did. I didn't pull something. I don't think I slept wrong, but it's just getting me today.
Right.
So sometimes we don't know where it came from. It could be as simple as my head happened to be turned and I coughed, and it just kind of put something a little bit out or a little irritated, and then it builds upon that. But we have, when we talk tech neck and we talk lower body type of things, it's upper crossed and lower crossed syndromes, meaning that we see that we're in a position, our postures are coming forward, we get tight in the anterior muscles, we get kind of overstretched and a little bit weakened in those posterior muscles, and we're not keeping our shoulders back and our head back where we should. So we start to lose curvature. And we see the same with the back. We get really tight in the hamstrings and hips.
Right.
We lose strength in those hip stabilizing muscles that we need, and our posture then suffers, and we start to have problems. And there's so many things that we can try to prevent with injury if we can address the posture first. And try to get out of that. And we used to worry about kids with heavy backpacks and being hunched. Now we're hunched because we're looking down at phones and driving. And 100 years ago, you would pull back the reins on the horse and we had a good posture because you were upright. And we don't see that now. We used to walk everywhere. We used to ride our bikes everywhere. And now We
Now we're
sit in a car and go everywhere.
and go.
And kids are unfortunately suffering much more than we are.
Man, I picked my son up from school today, and his backpack.
Yes.
I didn't think that I would have thought with a Chromebook it got lighter. You know
Yes.
what I mean? But it's not. It's
No.
just another thing that's in. I'm like, dude, how do you even lift this
That's
thing,
right.
bud? Like that's not. You talk about posture. I mean,
Mhm.
you're hitting them at 6th grade, 7th grade. They're
Yes.
carrying around these huge things on their back,
That's right.
and they're hunching over. And I'm watching. It's like, man. Then you put them in a 9 to 5 with a in a booth, and you're 9 to 5 punching it out, and you're looking at a computer, man. And it's how would you even? Where would you start with someone comes in with they say, hey man, like you diagnose them with tech neck, like where would they go from there?
Again, it's education.
Yeah.
It's, I never mean to disparage another facility. I don't mean it in this way at all, but a lot of times places don't have that ability to spend the time and do the education the patient needs. It's more of, I need to have productive units of hands-on things, and that's important, but you have to educate as to this is why this is important. Again, 168 hours a week, 2 of them are going to be with me. I can't fix you in 2 hours. I got to teach you what to do in the other 166. So it's understanding that we need to get you out of this posture. This is why this is detrimental. This is what you need to do to get out of this. So it might be adjusting your monitor and your workstations. It's getting up frequently every 20 minutes and looking out in the distance 20 seconds and trying to roll your shoulders and stretch your back. It's getting in there and knowing which stretches should I do, what exercises can I do at home without having to go to a gym. It's fine if you want to. I can show you anything you want in the gym, but not everybody wants to do that. So it's trying to show you what can I do. And then once they understand that, after that first session, and I really try to hammer that home, then let's get in there and get you feeling better. It's not just let's put hands on and take care of the symptoms. My dad said it once beautifully. He said, if I've got a nail sticking out of my head and it hurts, I can take an aspirin so it doesn't hurt, or I can take the nail out.
It's perfect. That's
so
a perfect
if
analogy
all I do is go in there and rub somebody's back or try to do an adjustment on a spine or whatever, it's like, okay, that's important. It doesn't mean you don't need it, but you need a lot more than that. And I have a lot of people that come in and they say, I've gone here, I've done this, it didn't work, it failed, or I had to keep going back for this over and over, and I'm tired of doing that. It didn't fail. We just didn't have the right thing for you at the time. We need to come up with what's the best exercises done the right way. I don't like to just say, here's a handout. And that's why Dr. Google's not the cure, because you don't really know what you need. You can get some general ideas. I have a lot of physicians that say, here's a handout. Go do this. Well, it may be okay, but there may be some things we need to do better. And maybe if the patient doesn't know exactly how to do it, we need to make sure they're doing it right. Why spend the time and then say, oh, it didn't work. I guess I need something more now. I need a pill. I need a shot. I need surgery.
Man, they need 11:15. We got to get out of there, Jeff.
It.
You know what I mean? We got
absolutely.
Stuff.
So it's getting in there, and again, yes, we want to get you feeling better right away, definitely. And we're going to do a lot of things. I can do dry needling, I can do cupping, I can do instrument-assisted things like Graston. There's a lot of modalities I can get in there, as well as hands-on things with trigger point releases and soft tissue mobilizations and joint mobilizations. But it's not the only thing. Again, I don't want you dependent upon me to fix you. I want to show you how to fix yourself, and let me do the things you can't do. But I need to be able to spend the time with you to do that.
Right. And I think that level of care sometimes is we're so used to not getting it. So when you do get it,
unfortunately, yes.
I went to even just little things like going to the dentist. I went to a dentist down here, and it was a completely different experience than when I was in the heart of the city. It felt just like, time's up, we gotta go.
Yes.
And man, I sat down. I even told my wife, she laughs at me. And I said, when I sat down in that chair and I looked outside, and there was just a little thing like a bird feeder, just little things like that, where it's like they care. You know what I mean? They want you to be. They don't want to. Instead of just having a TV on the top of the thing, they're talking to you. And I said, I've never been treated like that at a dentist. And you give me the same kind of vibe where it's like, no, dude, it's your fight. I want to help you fight it. But you got to know it's your fight. And you have to do the things to make it better. Because again, you see for 2 hours a week or something. How many other hours?
168. So 166 are on you.
And it's like, it's on you. And I think that level of care is sometimes because we're used to it, not getting it. So when you do get it, it's a huge deal, man. Well, it really is.
Consumers, again, don't really know what to expect, or they've had something. And I'm sure every therapist and physical therapist out there is going to tell you the same. Oh, I have a neighbor and I said, therapy's torture. PT stands for pain and torture.
Yes.
You're a physical terrorist type of thing. We get the
Yeah,
same
dude,
joke
yeah.
for 30 years. Yes. And that's okay. But it doesn't have to be that way. And it's
Right.
not that way when it's done right. There are times that some things you might have done is a little painful, but it's not agony and it's not torture and it's nothing like that. It's, and I have people that come in and say, I was kind of nervous coming here at first, Al, that I thought this was going to hurt. This wasn't that bad. Well, it shouldn't be. Again, we're a team. We've got to work together. You don't know all the answers. I'm going to try to show you, just as a coach would.
Right.
It doesn't mean I'm the greatest ball player. It doesn't mean that I know every aspect of the game. It's that I can show you some things that maybe you don't see in yourself. So let's get there together.
Let's make you better.
Absolutely.
That's what, yeah.
And that's the whole thing. It's not existing in life. I want you living your life. We want to
Right.
get you back out and having fun with what you want to do. If you say, I want to go for a hike by myself and not worry about falling, we've got a lot to work on with your balance to get you there and your endurance and your stamina. But if, we got to figure out what's important to you. We got to come up with what's the why. What are you, why is this important? What is it you want? I have so many patients that come in and I want to get on the ground and play with my grandkids and be able to get back up. And it's something that's
what's
simple.
up. Like that's what I want to do. That's what, you know what I
Absolutely.
mean? That's what we're here for.
Yes.
And if you can't do it, like instead of just saying, I need a pill for this or I need something, it's like, no, let's address the problem in the room.
Yes.
That is like, let's get down and play Legos. Let's get down and do the Hot Wheels.
It's not
Let's
how
do the
much
things.
can I bend your knee,
Right.
and it's not what is your strength level. You can sit in a machine and kick your leg up and down. I've never once had to do that in my life, a single day. Doesn't mean it's not a bad exercise to do, but it's more than that. It's got to be functional and it's got to be meaningful to the person. And again, what is your why? And once we identify that, now we can fix it.
Now you can build off
But
of
I
that.
have to have that motivation you have to be internally motivated to do it. You got to get that compliance, and you're not going to get it if it's just, hey, I hurt and fix me.
Yeah. Yeah, dude, that's so valuable in 2024, man.
Yes.
That kind of level of care is just, it's hard to come by. I do have a question though.
Yes.
There's an 80-pound weight over there. Has anyone lifted that yet?
Oh, yeah.
Really?
Yeah.
You?
Somebody had to put them there.
Yeah,
Yes.
it's true.
Yeah, I do my wrist curls with those hundreds over
Yeah,
there.
just
Yes, of
light
course.
work, dude.
Yeah,
Just
that's just
light
warm up. But no, those are legit weights.
Yeah, dude.
The gentleman that had this facility before, this was a personal training gym in here at one point. It was like a private gym.
Yeah.
And so when he's looking to get rid of things, I said, I could use the weights. I don't need all that weight. I honestly don't go much more than 30 or 40s.
Yeah.
But there are times that I have an athlete coming in and I want to teach them the right way to lift. I've got a number of baseball players I've seen this summer before going back to college.
Yeah.
And hey, we know we're going to be lifting, let me show you how to deadlift. Let me show you how to squat. Let me show you different ways to do things, because I'd rather teach you the right way, because when you get there, your coach might not have a clue. You might have strength and conditioning coaches there, hopefully, but they might have 20 athletes. And hey, here comes the football team, and we don't have time to worry about, are you doing your proper lift?
Right.
So let's do it the right way. So I do need all of that, but yes, do those hundreds get used? No, not too often. No.
I
But
love
it's
seeing
impressive.
them over there, though. Yeah, I know. I love seeing them because I'm one of those people that love seeing the carrot on the stick. You know what I mean? I love seeing, because I feel like that's what drives me, is I have to see the next thing, so even if I just came in and did, 30, 40, but I would come in here and just look at that 80-pound weight,
Yes.
all the time. It's I need to be able to lift that.
Whatever motivates.
Yeah,
That's the
exactly.
But I do have people also that, and you'll see it in the gym, and you've been around, throwing enough iron too, to know you'll see people in there lifting incorrectly, because I want to show that I can do these 80s. Nowadays everybody's wanting to film it all, and everybody's got their camera set up in the gym, and that's what's the beauty of here. I have personal trainers that work out of this facility with their clients, and they don't have to worry that they're being filmed or walking in somebody's camera and they're like, I need to get the weights, but I can't get over there to get it. So it's very personalized here, and the same idea. It's functional fitness that everybody's focusing on. But it's, nothing wrong with lifting 80s, but let's lift it right.
Right.
Let's do the proper form, proper technique.
And that's what's been the big thing with myself and my oldest son. Whereas they're working out in high school, they're doing those things, but I want to more get him into the gym, because I want him to do it right.
Absolutely.
Because it scares me when I've seen, youth sports and walking into some of those things, and these guys are just like, I'm just going to deadlift. And you're like, dude, you're going to do some. I understand you're only in, 8th, 9th grade, but you keep lifting things like that and you're going to have some problems, bud.
And unfortunately, I've seen a lot of that over the years, and it's hard walking into a gym myself, because I see things, and every therapist and every personal trainer can tell you that same story. It's hard watching, but there's some crazy stuff out there.
Yeah.
But I love having somebody like that come in. The kids are like, or the parents saying, can you just show them how to do this? Absolutely. And no, they don't need to lift the heavy weights. Let's lift the light weights properly. And you'll see that, I can give you a workout with 5-pound weights. It's not, what you're lifting, it's how you're lifting. That's the biggest thing. It's not, what you're training, it's how are you training? Where's your focus? What are you concentrating on?
So if an athlete came in here and just said, hey, I really want to work on my speed, you can take it from there.
Oh, absolutely.
Right? Like, yeah, like you're like, that's, you said earlier about your why. If they came in with a why and said, hey man, I just want to get my feet quicker.
Yes.
You're like,
that's
perfect.
Yes. I do sport performance enhancement here as well. So if somebody comes in and I want to be quicker off, I want to improve my agility, my balance, my hand-eye coordination, I've got all the tools for that. I have things like devices I can put up where they're actually trying to hit lights that are coming on randomly. I can have them on unstable surface doing it, whether they're swinging a pickleball racket or they're trying to just reach out and touch it. We can do those things. We have push-pull sleds and areas as you see with the turf off to the side here where they can do working on acceleration, deceleration, explosiveness. I have one gentleman that was a boxer coming in from Lenore, and he said, I need to be more explosive. He's 20-year-old and a pretty high-level boxer. Pretty
explosive already, dude.
Yeah, I'm thinking, boy, but I took him through some things. He's like, wow, just looking at it differently of how we wanted to hit his core. It's like, you're fast, you're strong, boxing, but I can show you how to try to get a little bit better rotation to be more explosive. So there's just a lot of ways to approach it.
That's so funny. My dad was a big boxing fan, and his favorite boxer was George Foreman. And I was like, out of all the boxers, do you know what I mean? Like, you picked George Foreman. And he said, I remember, never forget, he looked at me and he was like, you have no idea how he uses his body.
Yes.
Like, he might be a big guy. He was like, but the way he swings his body, he said, Chris, it's unlike anything I've ever seen. So then, but I would have never thought of it that way. It would have just been a big guy up there swinging a bag. You know what I mean? Well, he's knocking people out because he's a heavyweight.
Yeah, he was one of the hardest hitters ever because he knew how to tie everything together.
And then you hear stories, about him just punching a bag for 40 minutes. But he said he would start over if he was out of form. Yes. And you hear guys like that and you're like, oh. And then I look back at what my dad said about it. And it's like, he wasn't kidding, man. Yeah. But how did he get that? It wasn't because he did it. It's because he was open to learning about how to get better and how to use his body and how to do it.
The biggest holdback for people, it's the 6 inches between the ears. It's, if you get that right mindset, and for him, he's so internally motivated to do it a precise way every time. You can look at these elite marathon runners and every step is perfect. They know exactly where that stride is going to be for 26 miles.
Because it has to be, because it's 26 miles.
Exactly. And you're thinking at that pace for that distance and every step you're thinking, and they are so locked in and focused. And that's what separates the elite from all of us. It's, you can say genetics and training and, do they have the right nutrition? Are they being enhanced? And, there's so many things, you can do that are legal and illegal, but so much of it's, you've got to have the mindset. If somebody says, hey, I'm going to take steroids, I'm going to be a bodybuilder. No, taking steroids doesn't get you bigger. You still got to be disciplined to look. You're choosing to do this to help your recovery, but you still got to know how to lift properly to get to that level. Otherwise, you're just a big guy.
Right.
You're not a bodybuilder. It's being able to focus on, okay, what do I need to concentrate my energies towards?
I love that you said the battle. I tell my kids, and I tell anyone that will listen to me, and they're just like, oh, whatever, Chris. But it's the battle within.
Yes.
I mean, it's in your head. And it's everything. That's everything. Because it's called, it's resistance is what I tell my kids, is that little voice in your head, that ego, just feeding you, nah, you don't need to do, Chris, you do 2 miles every day. You don't got to do 2 miles today, right? And it's not until that click in your head where it's like, no, you battling yourself that I'm going to do this today. I'm going to, even though it's raining and it's a great day to sleep in Hickory, you know what I mean? I'm going to the gym because I need to and because I want to.
And the biggest thing is afterwards how you feel. And it's like, I'm so motivated because I took my mind over
Yes.
You know, I got control, and that's the key, is being, and that's how it is in everything.
Yeah.
You can eat whatever you want in moderation.
Right.
It's being able to say no. It's, you know, if I want to have a drink, yeah, that's okay. But when do you stop? It's being in control of whatever you want to do in life, you know, and that's, you know, not to get too philosophical, but that's really where it all comes down to. We all make those choices, and sometimes we take the easy choice, and that's okay.
Right.
Sometimes you're going to make a mistake. That's okay. Get back up and fix it.
Right.
You know, there's nothing wrong with that. You don't, you know, just because you made a mistake doesn't mean it's over. You know, I blew my diet. Okay, then start over again.
Right. And it's that ability to fight back against that voice in your head, to challenge yourself, to do that. And man, and it's so funny that, and let's wrap up with this, because man, I'm looking right down the hallway, and it right at the top, if it doesn't challenge you, it doesn't change you.
Absolutely.
And you're absolutely right. And I don't care if you're 16 years old, I'm 42, and it took me 41 years to accept the battle within.
That's it.
You know what I mean? And then once you accept the battle and understand the battle is happening, then you can move on and start battling every day, because now you have an enemy. And unfortunately, it's the guy in the mirror. Yes. You know what I mean? It's all it is.
You've got it, though. That's exactly it.
Well, Jeff, I thank you for having us, man. This
I appreciate
has been a blast.
Enjoyed it.
And man, I'm going to try not to go over there and lift up the 80-pound weight. But I appreciate you, man.
Give it a shot.
This is great.
Thank you.
Thank you.
Appreciate it.
All right, guys. We'll see you next week.